Today, my guest is Harry Kanan, the Vice President of Caron Treatment Centers. I'm finding, and not surprisingly, that many treatment centers are run by people who have gone through the recovery process. And this is true for Harry. I heard his story recently, and although he is not a healthcare professional, I believe his story will resonate with those who are. I am of the belief that the more addiction and recovery stories we hear, it opens our eyes just a little bit more each time to the struggle, and it humanizes that struggle. And in doing that, my hope is that it paves the way for those of us in the diversion monitoring world to approach our roles with genuine empathy for those people. And in doing so, we'll have more success in reaching them ultimately. So thank you for joining me today, Harry. I appreciate your willingness. You know, although you've probably shared this story countless times, I don't imagine it's easy to do. So I really do appreciate your willingness to do it. And so I will just now turn it over to you to tell us your story and what you have gone through.
Thanks, Terri. It's a true pleasure to be here and have this conversation with you. I want to just mention you used a word that I think is so important, to humanize this. And I think that, I'm grateful for you giving a platform to talk about these issues and talk about it so that we can see it as healthcare, right? That people who are struggling with a substance use or alcohol use disorder, it's not a moral issue, it's a healthcare issue. And I think, along the lines of diversion and in the healthcare setting, it's so important that we know that and we see that, and we treat it and identify it that way. So I'll tell you a little bit about my story. I'll try to keep it brief. I could go on and on, but, I always like to start by saying I'm somebody who grew up in an incredibly loving home. I'm not, a victim of any major trauma. I have two incredible parents that raised me in a loving and compassionate way. And, I say all that to say that, I went through the DARE program. I did not believe or ever foresee that I was going to be someone that was really in a bad spot with an opioid use disorder. I had thought that, that was something that almost couldn't happen to me. I think alcohol is always a little bit different because it's so culturally accepted that I saw and understood drinking alcohol, but I couldn't understand drugs or using, illicit or prescription medication or misusing it was something that I would find myself doing. But what I found was, that it's really this slow and slippery slope for some people. When I was in high school, what felt very normal was people would drink, and on the weekends we would drink and we would have house parties, and it felt pretty innocent, right? It felt safe. It felt normal. It felt like that's what kids do. We're experimenting. And from there, it was really just this progression of, once I had crossed that line and I was drinking before I was 21, it just became a little bit easier to say, hey, you know what, marijuana's around, I'll try that. And again, the first time you do it, and I think that this is an important way to think about it for people who haven't experienced this, right? But, that first time I smoked marijuana, I didn't think that I would then smoke marijuana every day for the years to come. I thought it would be something that I could do casually. I could do it at a party and I could put it down. And what I found was that I loved the effect. These substances work. They have an effect that makes us feel good. And for me, that was a feeling that I chased. And, despite negative consequences, it was something that I continued to look forward to and find a way to do more of. And it was really through that, through that first step from alcohol to marijuana, where then I've kind of opened myself up to what I considered at the time drugs. And, and the progression continued. I went to cocaine in high school, and that became what I sort of say was my drug of choice throughout high school. And at that point in my life, I'm 16 years old. And just 2 years before, I couldn't fathom the person that I was. I couldn't imagine a life where I'm lying to my friends, I'm lying to my parents, I'm lying to everyone around me, because I know this is wrong. right? I have parents that wouldn't condone it. Even my friends wouldn't condone it. But I felt like it was a solution to a lot of the teenage angst that I was feeling, the discomfort of sort of coming of age, and the drugs provided a really effective short-term solution to that. And again, I couldn't see where this was headed. I thought this could be a phase. I thought, I would eventually, I would grow up and I would stop. And, my first attempt at that was an attempt to go to a college that was far away. So I did quite well in high school. And I was accepted to 13 colleges and had a lot of different scholarship opportunities. And I intentionally made the decision to go to a school in South Carolina because none of my friends were going to be there. And I thought without those friends, I would stop using, right? I would have a fresh start. And, there's an expression in recovery that I think is useful in any setting. And it's, we bring ourselves with us wherever we go. And that was sort of the start of me realizing that maybe it wasn't a friend's problem, maybe it was a me problem. But it continued to progress, and from there, I switched to prescription medication that I was sourcing illegally from drug dealers. I was on opioids, and it really went downhill for me from there very, very quickly. That's where all of these other things, the images, that picture of what I thought a drug addict looked like began to be closer and closer to my reality, where, I became sort of incapable of taking care of my responsibilities. My health was deteriorating. I was losing weight. I was sick. If I wasn't high, I was in withdrawal. And I was stealing from my family and anybody around me to try to maintain this high to something that was very expensive and I couldn't afford. And, I knew at that point that I needed to stop, and I didn't know where to turn to. And there's this, this sense of stigma and shame that goes along with this disease that can be so crippling that, I remember at that time thinking, I didn't know much about treatment. But I knew people who had gone to rehab. And I always thought like, that's great for them, but I can't do that. I couldn't do that. I couldn't put my family through that. I couldn't put that shame on them by, identifying that their son is a drug addict. And I also didn't know what other help was available. I just thought that was it, right? You go away for 28 or 30 days and that's how you fix these problems. So I tried to do everything I could to avoid that. And, my life sort of came to a head at 20 years old. I found out that a girl that I was seeing was pregnant and I was going to become a dad. And at this point in time, I used every bit of willpower that I had to stop using. I tried, honestly, everything that I could think of, from using other medication to try to taper myself down and switch substances to, I tried to become a police officer. I went through, I took the exam, I made it all the way to when I needed a physical and said I can't go because I know I'll fail the drug test.
Right.
But I was desperate. I was willing to try anything other than asking for help because at that point in time, I didn't see this as a medical issue. I saw it as I was a bad person. I saw it that, I couldn't ask for help because I was too ashamed to ask for help. And when my daughter was born, I found that wasn't enough, right? I wasn't able to stop. I continued to use. And for the first year after she was born, I continued to use in that same fashion. And, finally found myself confronted by my family and was confronted and offered an opportunity to go get treatment. And I remember some of the things that went through my mind then, right? Because at this point, I'm 22 years old. I have a 1-year-old daughter. I had dropped out of school and I'm working full time and I'm trying to keep the wheels on this thing and they're just falling off. But I felt at that point that, there were so many barriers. I couldn't go away from my daughter for that long. what would happen if I left work for a month? Would I be able to go back? What would happen if to my family and my relationships if they found out? And it was a really scary prospect to think about going away to treatment. Really, I think almost entirely because I didn't understand it. But when I got there and I was introduced to the idea that this was a disease and it required, long-term treatment and care and could be managed, right? It's a disease that people can and do recover from if they're given the right tools and resources and support. And, so I was fortunate to have access to really high quality long-term treatment and a supportive sort of environment where I could come back to that was structured and had a lot of accountability. And I think that that's another really important part, is that it's not just an episodic treatment. It's a long-term care model that we need to talk about when we look at this, because it doesn't just get fixed in 30 days. But I'll fast forward just a little bit from there, from the 22-year-old that was so afraid to get help, that couldn't imagine a life where I didn't use drugs, to what, a little bit about what my life looks like today and why I think it's important that we share these stories to humanize this, right? Because there's, the current estimate is that there's more than 23 million Americans in recovery. And, that's a
Wow.
very significant number. But culturally, different segments of recovery, especially based in sort of 12 steps, there's this principle of anonymity. So what we find is that so often people do recover and go on to lead really meaningful, positive lives, but they don't talk about it. So we rarely see the positive side of this. We see the news stories. We see the 108,000 people a year dying of overdose. We see, the images portrayed in movies that look like somebody who's homeless or living under a bridge.
Mm-hmm.
We don't see the high functioning people, that are struggling, or the high functioning people that have regained some control over their lives and are in recovery. So, I've had the opportunity now, I work for care and treatment centers. And it's been such a gift for me to be able to work in an environment where I can be really open about this. And I know that that's not easy in every setting, in different corporate settings or in a healthcare setting, that can be much more challenging to be as transparent. But I think back to your point at the beginning, if we humanize this and look at it, through that lens of a disease model and through the lens of healthcare, rather than a moral failing, it's not that different from if you struggle with depression or if you struggle with a different mental health disorder or chronic disease such as diabetes. It can be managed, and it can be something that, you can come out on the other side in a really, really good spot. But if we don't talk about that, we keep people from getting help because they're afraid to ask for help and they don't know what's out there. They don't know that there's many steps that you could take before it would need to get to residential treatment. So I think, it's important for me to be able to share a story that is just one story. Like I said, there's more than 23 million of these stories out there. And I think the more that we can get them into our culture and society so that people see the hope, more and more people will be willing to talk about it and that stigma will come down. The last thing I'll mention is, and I think this is sometimes misunderstood, is there was a study last year that, that shows that 75% of people who struggle with an alcohol or substance use disorder at some point in their lives do eventually recover. And that's with or without treatment. Many of them don't end up in the traditional treatment setting. But they experience a time where they have an unhealthy relationship or use of substances or alcohol, and it does get better. But again, people don't like to talk about that because it's uncomfortable.
Interesting. Yeah, 23 million people, for goodness sakes. That means, most of us probably know somebody, whether we realize it or not, but it's certainly not a topic we're gonna, hi, my name's Terri. Do you have are you in recovery? And be like, huh?
Yep.
But you also talked about the depression and anxiety piece of it. I think people have a hard time talking about that too. I think we don't want to appear weak, right?
Yep.
I mean, most people are not totally honest with what they're struggling with or what they're going through, and we don't always want to be honest. I mean, that's the last thing that, hey, how you doing today? Really, today's not very good. Well, you start listing off all the troubles in your life, right? People don't really want to hear that. But I think that on that flip side, if I wasn't complaining about, the small little details of the, it's like really, as my kids would say, first world problem, but it was something deep, like, what, I'm really struggling with my depression today, that people, I think we would find they would be more open and willing to help and would like to have the opportunity to help than we think. But we still don't want to talk about those things.
Yeah.
But yeah, with those numbers, there's a lot of people out there that are struggling. And, and I find it interesting too, in your case with your story, that, you came from a good family and yet you still did not feel that you could go to those loving parents and say, I need help. And so the people that don't have that loving support system, how much more than they probably struggle with that thought of, I can't, like, who can I go to for this? So it's just, I don't know if fascinating is the right word, but it is just, the more stories I hear, it is interesting to hear those internal struggles that one with a substance use disorder is going through. And, you get there different ways, but a lot of it is very consistent in terms of, I'm just embarrassed. I cannot reach out for help. I don't know. What do I do with my life? Now is not the time for this. But yet you still recognize that help is needed. And the question is, how do I get it? So yeah, there's a lot to unpack there. And you talked about the barriers, and, when we start talking about, yes, you had a daughter that you were, trying to support and through work. And so that was definitely an obligation and a responsibility. And when you start thinking about, the healthcare professional that is working, obviously their income matters. And in some cases it might be a single parent or school loans or what have you. And so those are all things too that are in the back of their mind, that now is not the right time. I can't do it right now. So those are just one of the barriers. Now, your treatment center, let's talk about that a little bit. I believe you have a special arm for healthcare professionals. And do you need to get a drink of water? Because I can see you're struggling with, you got something stuck there.
Yes. Yeah, I'm fine now.
Okay.
But, no, I'm recovering from strep throat, so it's just
okay.
Yes. But, I think you touched on a lot of things in terms of the barriers. And one of the things you said, it, felt like it wasn't the right time. And I think that that's something that, if I could highlight, and there's one takeaway for anyone who's listening, that knows somebody or might be struggling themselves is, from my experience, both personally and working in this field, for everybody, it's never going to feel like the right time. Always a barrier. There's always an obligation. There's always something that's going to make it challenging. And because of that, usually the right time is as soon as possible, right? Before it elevates or gets worse, or something happens that could have more permanent consequences. So, so I think that's a really hard thing to grasp and to go with. I know if someone told me that when I was struggling, I don't know if I would have jumped at getting help right then and there. But, I think you can't say that enough, right? Another one of the barriers that, we didn't really talk about, but I think is really important and leads into, what we do at Caron, is this sense of, who's going to be in the milieu at a treatment center if you go into a rehab. And I think there's oftentimes, especially for working professionals and what are considered sort of high functioning individuals who, may be really successful in a career, may have, multiple areas of their lives that are going very well. Financially, they could be great, but that doesn't mean you're immune to a substance use disorder or an alcohol use disorder. And some of the barriers specifically there that come into play is, especially if you are the breadwinner, for lack of a better term, if you are the one providing the financial resources to your family, one, there's fear, but there's also a difficulty on the family members potentially to confront you about it because they feel like they need you to keep working.
Yeah.
And for the person who's doing it, that's going to be internalized also, right? If I do this, if I lose income for, a week, a month, 2 months, what's going to happen to my family? So it adds so much more pressure, but it adds a lot to the family dynamic to make it really, really challenging. But back to the milieu, what I think is important to know, and Karen does this really well, but we're not the only one, right? There are a lot of treatment centers out there that are very, very intentional about, putting specific groups of patients together when you go to treatment. So when I went to treatment, I found myself in what was called a young adult male program. So it was specifically just the 18 to 26-year-old, sort of those who had not yet, really established themselves in a career or a stable footing on their own yet, which is important because a 35-year-old who has a home, has a wife, maybe has young children, they're going to have very different circumstances. And what's so important in recovery and in treatment, but really in recovery, is finding that connection. We don't want people to go in and feel like, they can point to everyone around them and say, well, I shouldn't be here because I'm not like them. And so creating environments where the patient milieu is very similar. So at Karen, we have programs specifically for executives, people who are very successful in their career. And, a program like that allows them to continue working while they're in treatment. And they're with other people who are very similar. They're in that same spot where if they're talking about their family dynamic, they're going to find some relatability. And it's the same thing with our healthcare professionals program, in that, in that program, it's people who have a license on the line. It's a doctor, it's a nurse, it's someone who, could potentially lose their livelihood, lose the license to practice medicine. And we have a team of clinicians that understands that and knows what that process looks like and knows what it looks like to work with the licensing boards in order to maintain that and work effectively with the monitoring programs that come into play post-treatment for healthcare professionals. But again, when you have someone who has that fear and shame and stigma, going into treatment, when you walk in and you can be in a room of other people and see that, hey, I'm not the only one. It's there. If you're in a room with other physicians, you're going to feel much more comfortable, much more quickly. And that's a benefit for the treatment process, right? Because you can get more out of it because you'll be much more actively engaged.
I think it would be also too, another advantage might be that don't make excuses. Because everyone in that room is like, okay, you're just, that doesn't that, let's just get real. For somebody who's brand new coming in, that's still a little bit in denial.
Yeah. And it also allows us to really tailor what the treatment, education looks like, right? Sure. We have a program for lawyers as well. And it's, so if you're giving this information to a patient, if it's an 18-year-old, you're probably going to need to deliver it in a different way than somebody who's been through medical school and is a, successful surgeon. They just have a different understanding when you're talking about a medical condition. So the program is really set up to do that. So again, I think, related to diversion programs or anyone who's struggling in a healthcare setting is knowing that, there are options out there. There are specialty programs that are really tailored to the needs of a healthcare worker. And you're not going to be in a position where you feel like,
Right.
I don't
Yeah.
belong
No,
here.
I think that's great. I think that's a fantastic model. Do you have, you probably don't have statistics off the top of your head, although maybe you do, of healthcare professionals that come through your program. Do you see most of them going back into some form of healthcare and their recovery is successful long term?
So the large majority do. The one that, we do see more often than not, they wind up finding a new specialty is an anesthesiologist because of the access to diversion, and just the access that they have to really, really powerful medications. But really, in just about every other specialty, we see that they do go back. And the other thing that's really, I think, special about healthcare workers, because of the physicians monitoring programs specifically, and also with nursing monitoring programs, is that the outcomes are really, really good. The success rate for recovery is incredibly high because there's very long-term accountability. So it's not easy, right? But they're almost forced into longer-term drug testing and monitoring. And that accountability and additional support really, really helps to drive up outcomes where, in a space where, typical treatment outcomes are not where we want them to be, because not everyone has access to that ongoing care and accountability and monitoring. The outcomes in the healthcare field are very high for that reason.
Do you find any better success? I mean, we usually say in the healthcare setting, let's find them as fast as we can, because the sooner we find them, the higher the chances are of recovery. Certainly the higher the chances finding before they cause harm to themselves or somebody else. But in terms of the recovery, I mean, do you feel that that's an accurate statement? If you find them quicker, then they have a higher chance?
Yes. And I think that is accurate across the board, not just with healthcare, but, like with most diseases, if you catch it in an earlier stage, the ability to treat it becomes much more dynamic if you don't have to go right to the most extreme methods of, that really long-term intensive inpatient treatment. If you can catch something early, there's a much higher likelihood of success with someone just doing an outpatient program, or success with meeting with an individual therapist. So the outcomes are much better. It varies substance to substance, what the true impact is on a person's brain and how long that takes to heal. But, without a doubt, if you can catch this sooner, the outcomes are much better because people are in a more receptive spot in order to receive the treatment.
Okay. All right. And you had said something when I heard you speak prior that I thought was a really great statement. And in fact, I have given that to somebody else who has a loved one who just checked themselves into an alcohol recovery program. But someone had told you, you are not a bad person trying to be good. You're a sick person trying to get help. And, we have to remember that.
Yeah.
And we've kind of talked about that today, right?
Yeah.
They're sick. It's like other medical conditions. Now you have written a book, right? Can you tell us a little bit about that?
Yes. And really quickly, I do want to say, I mean, that message, when I heard that, for me, that really opened the door, because I did believe that I was a bad person, and I had never been really introduced to this as a disease or something that it could be solved through healthcare. I thought I was just incapable of making the right decisions, even though I wanted to. So the book, my mother and I co-authored a memoir that was released last year called Under Our Roof: A Son's Battle for Recovery, a Mother's Battle for Her Son. And for us, it's really special, but it's important to talk about that this is a family disease, right? This impacts the whole family. When someone is struggling, it's really something that is incredibly hard on the family, and the family involvement is something else that really does improve outcomes, right? If the family can get on board and understand this, the patient can have a much higher likelihood of getting better. But so our book is really a journey of what our family went through, and we wrote it in alternating voices, so that each chapter, goes section by section, where I'll write and she'll write. And it's a really raw and vulnerable account of what it looks like. So when it starts out, and we're telling the stories, it's almost like we're living in two different worlds, even though we're living in the same house, because of the deception and me trying to lie and manipulate about what was happening, and her not seeing it right away. And I think that that's something that we can relate to with coworkers, with family members, that even with so many of the signs right in front of us, it can be hard to believe. And we might, in my mom's case, and I think this happens in the work setting also, is even if we think it, we just don't want to believe it.
Yeah.
We want to think that maybe it's something else. Maybe there's some other reason that, these things are happening.
You're a teenager, for goodness sakes. I mean, yeah.
And it's trying to figure out what's normal, what's not,
Right.
what's experimenting, and what crosses that line. Is there a line, and where is it?
Right.
But as the book progresses and we find ourselves sort of entering into recovery, it really gives us an opportunity for our stories to come together, right? For that, it's kind of what is truth, and in the beginning of the book, it's both of our truths, but they're very, very different. And through recovery and sort of pulling together that story, one, we were able to rebuild a relationship where, and I think this is important for everybody, as a mother who wants to love and trust her son, I had stolen from them financially. I had lied to them. I had done things that, maybe no one other than a mother could forgive. But I know that she really struggled with the concept of, could she trust me again? Yeah. And we see that no matter what the relationship is, can I trust this person again? And what we found is that through recovery, through an opportunity to, slowly rebuild that relationship, it doesn't come back overnight. You don't just take away the active use and all of the sudden all of the behaviors and everything is fixed. It takes time and it takes a lot of effort, but you can rebuild trust. Right. And I think for someone, who's struggling, that's so important to know that, you might not get every relationship back. I know I didn't get every relationship back, and that's okay. But the ones that I did get back and the new relationships that I've formed since being in recovery are just so incredibly meaningful. Mm-hmm. And they're built on a much stronger foundation than anything that I had before. Yeah. Something I always feared, right, was, who would I lose? Who would be unwilling to forgive? And it started with having to forgive myself, because I really was not happy with the things that I was doing when I was in active use.
Yeah.
But I felt like
do you have any suggestions for the family member who is walking side by side with someone going through the recovery process? And I would imagine I have not gone through either side, so it's very foreign to me from that intimate perspective. But I have to think that it would be very natural for the mother, the father, the spouse, what have you, to be afraid that there will be a relapse, to not quite, where are you going? What are you doing? Who are you? Like, are you sure you didn't, but not wanting to make the person feel bad, but yet wanting them to be honest, but to maybe ask a question if they're kind of suspicious of something. How, any suggestion for the loved one that has somebody, knowing how that feels from that side?
So I have two that I often give out. And the first one really is, for both sides. If you don't know if this person is struggling yet or not, but if it's a family member or a loved one, I usually tell people to trust your gut. If you feel like something is off, there's a very real possibility that it might. And this is a disease that, the denial can be very, very strong. for a family member because they don't want to, admit that this is what it is. The other thing I think that's so important on the recovery side for family members to know is that it's important that they get support too. Back to the idea that this is a family disease. So much about recovery for the individual who's affected is about finding community and peers that you can relate to and identify with, and finding support through that. That doesn't have to be sort of like a 12-step group, but just finding a positive peer group that is supportive and understand what's going on. I think for family members, it's very much the same. And this often gets missed, right? Is that it's their problem. They need to do this work. They need to get better. But what we see is that when family members heal and find their own healing, that usually lifts up the individual who was struggling also. But it allows you to find an opportunity to find that healing sort of separate from how that other person is doing, right? Because this, it's a disease that can be very difficult, right? Relapse, a reoccurrence of use can happen. It's not a part of my story, but it's a frequent part of people's stories and experience with this disease. So allowing family members to have support throughout that is really important so that they're not tied as directly to the day-to-day emotions of someone who's
and then
really
I guess
new
maybe
in
through
recovery.
that healing process too, then both sides kind of find a way to keep those communication lines open and just touch base. I just want to make sure you're doing okay, but I don't want to harass you to the point of making you like, shut up, stop asking me, I'm fine.
Yes. It's a hard balance.
Yeah.
Especially, family communication is difficult with or without a substance use disorder. And so that's elevated when there is someone who's really actively struggling. But you're totally right. If both sides are in their own process of healing, and I say that sort of intentionally instead of recovering, but just healing, right? Because it's a very painful experience for everyone involved. If you or a loved one is struggling with this disease.
Right. Okay, great. Well, thank you again. And I look forward to reading your book. I haven't read it yet, but I do look forward to reading it. And, one of the things that we didn't discuss today, but one of the pieces to your barriers was your family's reputation, right? Your mother is fairly prominent and has been for a while. And congratulations to her win to the U.S. State Representative again. But, we all have those reasons why we wouldn't want to come forward. And you're not unique. And those of you out there that, may be struggling are not unique either. So there's no time like the present. Just do it, right? We can go to the Nike commercial. Just do it.
Just do it. I like that.
Yeah, well, it'll be hard. It'll be hard, but on the back end, then the reward is there.
Yeah, it's usually what seems like the hardest and the worst day or decision.
Yes,
can really be a foundation for a very bright future.
Yes.
But yes, to your point, being the son of a politician or public servant is, for me was one of the things that I thought I couldn't do that to her. I didn't want to jeopardize her career. But, again, to your point, we all have something. We all have a barrier that we feel like we can't overcome. But if I end on anything, it's that, if we look at this as healthcare, those barriers really start to melt away. Because if we had a different disease or a different condition, those barriers do not come into play without the stigma. So I'm grateful for you having me on and highlighting these stories, because I think it is so important that we talk about it and shift, culturally how we view this. Because if we can bring it into mainstream medicine and view it that way, there would be many, many fewer suffering individuals and families out there.
Absolutely. Absolutely. Well said. All right. And with that, we will conclude this. Thank you very much, Harry, for your time and for sharing your story.
Thanks, Terri.